Good morning. We're going to start the program now. My name is Steve Rabb. I'm the first vice president of Bethel Temple and a member of its GHIAA core team. I want to welcome you all to this morning's program. We will be discussing issues which have significant importance to our community and which are very much in keeping with our Jewish values. I want to thank the 5 synagogues which are co-sponsoring this morning's event: Congregation Beth Israel, Bethel Temple, Congregation Tikvoh Shalom, Temple Sinai, and Beth Shalom B'Nai Israel. I also want to welcome Rabbi Rosen from Bethel, as well as our guests from other synagogues and organizations. The format of today's program will include opening remarks on social justice as a Jewish value by Rabbi Debra Cantor, an introduction to GHIAA, its mission, priorities, and accomplishments by Cori Mackey, a discussion of racism as a public health crisis by Cori Mackey and Thomas Buckley, a question and answer period led by Tracy Tabak and Jane Zandy, and closing remarks with a call to action by Rabbi Andi Fliegel. If you have questions, you can enter them into the chat at any time. You'll be able to see other participants throughout the program, but everyone other than the presenters will be muted. Opening this morning's program is Rabbi Debra Cantor from Congregation B'nai Tikvoh Shalom. She will speak about social justice as a Jewish value. Prior to joining Congregation B'nai Tikvoh Shalom, Rabbi Cantor served as rabbi of the historic Kane Street Synagogue in Brooklyn, New York, and Congregation Beth Israel in Andover, Massachusetts. She was a member of the first Jewish Theological Seminary Rabbinical School class, which included women, and she's a graduate of Brandeis University. Rabbi Cantor founded the Neshama Center for Lifelong Learning in 2017. She is actively involved in interfaith learning and social action with credits far too extensive for me to recount here. Rabbi Cantor has been involved with GHIAA from its beginning. I've always found her to be insightful and engaging, and it gives me great pleasure to pass the program to Rabbi Cantor.
Thank you, Steve. Before we begin, I want us to look around at the faces on the screen, and feel free to take a look and to scroll through. We have 3 pages of faces. And I want to share with you a poem called The Blessing of Faces by my friend Alden Solovey. The Blessing of Faces. So many beautiful faces, so many radiant souls shining forth into our hearts. Look at those eyes, the smiles, the hopes, the fears, the yearning, the questioning, the compassion, the love. Take it in. Take it all in, the tenderness, the humanity, the blessing of faces arrayed before you, the blessing of faces given and received. And now I want to take note of something else. The faces on this screen are mostly white faces. And this morning, all of our speakers are white. It's important, I think, for us to acknowledge that fact up front. We've gathered this morning to address the issue of racism as a public health crisis. And this is an issue that affects every single one of us. It poisons our society. But the color of my skin allows me privileges that our Black and brown neighbors do not enjoy. The color of their skin puts them at risk every single day in myriad ways. We can be partners and allies in combating and undoing systemic racism, but we with white faces can never fully experience what it feels like, what it is like to walk, to drive, to apply for a job or a loan or a mortgage, to take a nap in a college room, what it feels like to try to hail a taxi to go to school, to sit in a restaurant, or even sleep in your own bed while being Black. So I want to share a useful term with you that was suggested by Thomas Buckley, one of today's other speakers. And Tom writes that a term he uses frequently is cultural humility, not cultural competence, but cultural humility. He says, I've worked for many years with Cambodian American survivors of the Khmer Rouge genocide, and the term cultural competency always seems like an oxymoron. As a white man, I would never feel competent in someone else's race or culture, but I strive to be humble enough to know what I don't know. So today, let's strive to be humble enough to know what we don't know. And at the same time, it's important to add this as well. Not all Jews are white. If you go to Israel, this is strikingly obvious. But here in our corner of the United States, most Jews are white and of Ashkenazi descent. But the thing is, not all Jews even here are Ashkenazi. Some are Sephardi or Middle Eastern, and their Jewish languages are not Yiddish, but Ladino or Arabic. And an increasing number of Jews are people of color, Black, brown, Asian. Those Jews have a different experience. They deal with racism because of their skin color and anti-Semitism because of their faith and ethnic identity. And Jews of color are often marginalized by our own Jewish communities. So I really want to lift that up as well. That said, my charge for this morning is to provide a Jewish framework for today's workshop. So now I'm going to attempt to share the screen. All right, let's see. Yes. Our topic for today, of course, is responding to racism as a public health crisis. And the best way I know to frame things in a Jewish way is to begin with a bracha, with a blessing. We're going to learn Torah. We're going to learn some wisdom today. And the Torah will be wide-ranging. We'll hear Torah from all of our speakers. So let's recite this bracha first in Hebrew and then in English. Baruch atah Adonai Eloheinu melech haolam, asher kitshanu b'mitzvotav v'tzivanu la'asok b'divrei Torah. Praised are you, Adonai, our God, ruler of the universe, who makes our lives holy with your mitzvot and commands us to engage with the words of Torah, not simply to study, but to engage with, to wrestle with, to ask what Torah, what these teachings have to do with each of our lives. So I want to show you a picture. Now, this is an iconic photo, and I'm just going to guess that lots of you recognize this photo. It looks familiar to you. And I'll bet that you can even identify at least a couple of the people in the front row. Not this nun, because no one knows who she is. She's just some nun that was there. But everybody else is pretty famous. And I know that I can identify a couple of these people. So look at it for a second. This is a picture of Rabbi Abraham Joshua Heschel. Here he is. He's the guy who looks like Heschel, looks like a rabbi, right? Big white beard and all that. And he's marching with other civil rights leaders from Selma to Montgomery, Alabama on March 21st, 1965. I have to tell you that he had suffered a major heart attack, and there's no doubt that participating in this march hastened his death. In any case, this picture was taken, this incredible picture was taken on March 21st, 1965. And we see a very young John Lewis, an unidentified nun, Ralph Abernathy, Martin Luther King Jr., Ralph Bunche, Abraham Joshua Heschel, and the Reverend Fred Shuttlesworth. When asked later about this experience, what it felt like by a reporter, Rabbi Heschel famously said, "I felt my legs were praying." I felt my legs were praying. And I want you to think about how this picture makes you feel. Let's look at it one more time. How does this picture make you feel? And feel free to write it down for yourself or to put it in the chat. How does this picture make you feel? Now, a little bit more historical context. Rabbi Heschel's daughter, my friend, Professor Susanna Heschel, a great scholar in her own right, who teaches at Dartmouth, she wants us to notice that the marchers are smiling, right? That's because President Johnson and Congress were finally on the verge of passing a Voting Rights Act, and because a previous attempt to march from Selma 2 weeks earlier on March 7th, 1965 had ended in, as we know, disaster when Alabama state troopers charged the marchers, attacking them with wooden clubs and tear gas, and that day came to be known as Bloody Sunday. But just as so many things, so many outrages are filmed today with video from our cameras, that violence was filmed and it was shown on TV throughout the United States that very night, and people were appalled. George Wallace, the governor of Alabama, refused to protect civil rights workers or meet with them. And President Johnson, who saw King as an ally, intervened and sent federal troops to protect the marchers. On March 15th, Johnson convened a joint session of Congress to press for passage of the Voting Rights Act. And he concluded his speech on national TV by dramatically declaring, "We shall overcome." And therefore, the picture on this day, the march from Selma to Montgomery on March 21st, had an air of celebrating a great achievement, a great, great achievement. Imagine 2 weeks after Bloody Sunday. Now, Susanna Heschel notes that Heschel, her father, was hardly the only Jew or rabbi to participate in the Selma March. On the contrary, we know that Jews flocked to the South to participate as freedom riders and to try to register Black voters. We know the names Andrew Goodman and Michael Schwerner, 2 Jews murdered by the KKK, along with James Chaney in Philadelphia, Mississippi during that Freedom Summer in 1964, and dozens of rabbis from Reform to Orthodox, including our own Rabbi Stanley Kessler from Bethel Temple, may he rest in peace. Dozens and dozens of rabbis went to march in Selma, and many raised funds to support the Southern Christian Leadership Conference. Now I want to show you another photo of the same event taken from a slightly different angle. Everybody see this? It's really the same lineup, but this shows something else. This photograph of the same event shows the other side. In the background, there's a large billboard. See that? It's a little hard to see, but in the background, there's a big billboard advertising Tepper's, a department store owned by Saul Tepper, a member of Selma's Jewish community and an outspoken proponent of segregation. He was a member of the White Citizens Council and a friend of the notorious Sheriff Jim Clark. And Tepper's active opposition to the civil rights movement was shared, unfortunately, by nearly all members of Selma's small Jewish community, who themselves felt threatened by anti-Semitism. And this is what Susanna Heschel writes. As the daughter of Rabbi Heschel, I have long felt that the photograph of the Selma March should not signal celebration, but challenge. Are we as Jews addressing racism, asks the photograph? Are we actively forging alliances with the African-American community? When will African-American and Asian American Jews feel fully at home in our Jewish institutions? Can we put aside our pride in the efforts of Jewish civil rights workers of the 1960s and recognize how much work is left for us to do? She says, let us take responsibility for the entire Selma photograph, including that Tepper sign in the background, for the warm smiles on the faces of the front row of marchers wearing leis and full of optimism for the future, but also remembering the horrific violence, physical and verbal, that surrounded the marchers. The photograph can bring inspiration only when we understand it as a challenge. My friends, today is April 18th, 2021, the 7th day of the Hebrew month of Iyar, 5781. It's the 21st day of the counting of the Omer, marking 3 full weeks since the beginning of Passover, when we began our journey from slavery to freedom. And now we are nearly, one more week, we'll be halfway to Shavuot, to Sinai, where we will celebrate our receiving of Torah. And today, tragically, also follows a week in which we saw and heard horrific testimony and footage from the trial of Derek Chauvin for the murder of George Floyd. While nearby in this same week, in a town right near Minneapolis, Daunte Wright was shot and killed by a police officer after being pulled over for a minor traffic violation. And in Chicago, Adam Toledo, a 13-year-old boy, was gunned down by police. During this same past week in Hartford, there were 3 homicides, including a 3-year-old and a young teenager. And these deaths join along an all too long list of Black lives lost as a result of police violence and gun violence in general. But Black lives are shortened not only through acts of violence, but due to well-documented health disparities. And this past year, a year of global pandemic, a pandemic which still continues, those disparities came into sharp and painful relief. And the root causes of these disparities are systemic, multivalent, and interlocking. Other speakers this morning will unpack these issues in greater detail. Now, originally, I thought that a great way to frame this issue Jewishly would be to marshal a whole series of Jewish texts. I know how to do that. I'm a rabbi, right? And those texts are super easy to find. You can start right at the beginning with the story of creation, right? There's one single individual, Adam, a human being. And the rabbis ask, why does the Torah begin with the story of creation, with the story of the creation of a single human being, to teach us that every single human being is created b'tselem Elohim, with a spark of the divine as a reflection of God. There is social justice embedded all over the Torah, especially in the book of Deuteronomy, where we have that constant refrain to remember that we were slaves in Egypt and to act accordingly. One of the most central lines of the Haggadah on Passover is B'chol dor v'ador chayam adam lirot etz atzmo ke'ilu hu yatsa mitzrayim. In every single generation, we are obliged to view ourselves as if we were actually slaves in Mitzrayim, in that narrow, constricted place. The Torah, our tradition, calls upon us not simply to sympathize from a lofty perch, but to empathize with the downtrodden, with the poor, with those who are vulnerable or live at the margins. The Torah insists that we identify with their plight and act. And the prophets echo this. They rail against injustice. The Haftarah, the prophetic reading for the morning of Yom Kippur, is from Isaiah 58. You think what God wants for you is breastfeeding and fasting, but God wants justice. God demands justice. Well, that's how I was going to begin, but here's the thing. I don't need to list quotes from you, not from you guys, not from the people on these Zoom screens, because you already know that stuff. You might not know the exact verse or quote, but you know that in your kishkas, in your hearts, in your souls, in your guts. You're a self-selected group, and you've chosen to participate in this workshop because you recognize systemic racism and the toll it takes on Black lives and our society on a whole. And I have no doubt that your Jewish identity is bound up with Jewish ideas and ideals about social justice. That's part of what makes you who you are and the kinds of Jews that you are. So I want to return now to share the screen. My friend and teacher, Rabbi David Jaffe, and by the way, go out and buy this book, the author of Changing the World from the Inside Out, A Jewish Approach to Personal and Social Change, he says, this is not only outer work, it's also inner work. It's a matter of cultivating the resources you already have inside. If you're serious about working for social justice and change, you must bring your most compassionate, wise, and courageous self to the job. And I would add humble self to the job. Bringing positive social change to any system takes deep self-awareness, caring determination, and long-term commitment. Sustainable activism is indeed a spiritual practice. I'll repeat that. Sustainable activism is indeed a spiritual practice. Here's what our friends, the Reverend Dr. Martin Luther King and his friend, Dr. Heschel, had to say. Somewhere we must come to see that human progress never rolls in on the wheels of inevitability. It's not just going to happen. It comes rather through the tireless efforts and persistent work of dedicated individuals who are willing to be co-workers with God, partners with God. And without this hard work, time itself becomes an ally of the primitive forces of social stagnation. So we must help time and realize that the time is always ripe to do right. This, my friends, is a moment. And this is a moment to engage deeply in this work and to know also that it's a huge task and that we have to keep at it. Rabbi Heschel said, morally speaking, there is no limit to the concern one must feel for the suffering of human beings. He says that indifference to evil, and keep in mind that his entire family back in Europe was murdered. Indifference to evil, he says, is worse than evil itself. In a free society, some are guilty, but all are responsible. Some are guilty, but all are responsible. And those words not only inspire us, but they could also cause us to freeze in our tracks, to be overwhelmed. And that's why I want to end with this, because this is how we might sometimes feel at this moment. So I bring for you a quote from the very beginning of the rabbinic period, the first century of this common era. Rabbi Tarfon used to say, Lo alecha hamlacha ligmor, you're not obliged to finish the task. Velo ata ben chorin o bat chorin lehivatel mimena, but neither are you free to desist from it. We don't have to finish everything, but we have to engage. And when we engage together across congregations, across faiths, across urban and suburban. When we do those things together, when we bring our hearts and souls as individuals, doing social justice as a religious practice, when we join together and do these things and work at those things step by step, piece by piece, we bring justice. We don't finish the work, but we take up the mantle from the previous generations and we do our best. And then we pass that mantle on. That is what we do as Jews. That is our holy work, the work that lies before us today and in the future. Thank you.
Thank you, Rabbi Cantor. Next, we're going to hear from Cori Mackey, who is the Executive Director of the Center for Leadership and Justice and one of the founding organizers of GHIAA. She brings 16 years of executive leadership and experience in urban ministry, social justice work, nonprofit management, and faith-based community organizing to the Center for Leadership and Justice in GHIAA. Her passion for engaging low-income communities and organizing efforts that bring about quality of life changes. She's also deeply passionate about the intersection of social justice and congregational life, embodied in a deep belief that church, synagogue, and mosque must be more than just a gathering space on Saturdays and Sundays. She holds a master's in divinity from the United Theological Seminary in Dayton and is a member of Emmanuel Church in Hartford. She's going to summarize what GHIAA's initiatives and priorities are. Cori.
Thank you so much. It is wonderful to be here with all of you. And Rabbi Cantor, thank you for reminding us that God demands justice. I think that's a good way to start in the framing of what GHIAA is and how it came to be. We know, I think, in all of our traditions that central to each of us, each of our institutions, is the call to do justice. I spent the first 15 years of my life ministry working in Catholic parishes, trying to get those who were seemed indifferent about injustice to care about it. And every couple of years there'd be a success with a couple of people who would like one of the workshops or one of the presentations, and they'd want to get involved. And then we'd realize we'd form a book study or we'd do a 6-week course on some topic. And I just found it year after year, I was like, where did the needle move on issues of justice? Where did our congregations actually make a difference? And that's when we started looking deeply at community organizing and faith-based organizing, and realized that unless there's a vehicle for our congregations to do this work and for our congregants to do this work, the most we can do is do the book studies and the forums and the conferences and the teach-ins. And so one of the things we had been looking at also was just this crisis in our congregations where when you look at the ministries that happen outside the walls of our synagogues and our churches and our mosques, they're largely charity. We have the soup kitchens, the food pantries, the turkey collections. And it strikes me that the prophets were not centralized in our sacred texts, and they were not murdered because they had sophisticated soup pantries and food kitchens. They were engaged with the most deeply fundamental power structures of the time, calling out the ways in which they were oppressing the poor. And that's what cost them their lives. That's what was at stake. And that is what's centered in our most sacred texts. And so how is it that we have all of our institutions, faith-based institutions, and yet almost none are deeply engaged in the work of justice in a way that moves the needle on these issues? And the reality is it takes a vehicle to be able to do that, because what's needed is power. We have to build the kind of power that's necessary to actually bring about some of the changes we want to see. And so that's what GHIAA, and I think humility seems to be the word of the day, tries to do, with lots of humility, knowing that there's so much out there that we can address and need to address, but we need to start somewhere. So about 4 or 5 years ago, a colleague of mine, Pat Spear, and I started meeting with clergy in the area to see which institutions had an appetite to look at organizing. And it turns out there was a huge appetite in Greater Hartford. Lots of clergy were interested in coming together for conversation. So they formed what was called a sponsoring committee, and clergy in the area met. About 40 clergy met for over 2 years every month and had meetings with each other in between, simply for the task of building relationship with each other so that they might conceivably trust each other enough to have their congregations begin to engage with one another in the work of justice. So over time, GHIAA was formed, core teams were formed in all of the congregations that founded GHIAA. And the core teams were groups of congregants who were trained in the principles of organizing. And in October of 2019, GHIAA was launched. Many of you, I believe, were there at Central Connecticut State University. We had about 1,700 people in the house, and we introduced our first issue slate. And we're going to watch a short 4-minute video that gives you a sense of that founding and also reminds you of the issues that GHIAA is currently working on. But I just want to say a minute about how those issues came to be, because I think that's what really sets GHIAA apart from a lot of the other efforts that are out there. Rather than just glomming on to existing issues, GHIAA arrives at its issues by building deep relationships with people in your congregation. So as individual congregations, folks build relationships with each other and across congregations. And we're deliberate to make sure that we have urban and suburban congregations, denominational and religious diversity, racial and ethnic diversity, so that we begin to really understand and know each other. And in these conversations that are structured and organized and facilitated by staff at GHIAA, we learn what people are contending with in their daily lives. What are the things that are actually impacting their quality of life? What's keeping them up at night? And in that storytelling process, we begin to see threads that are connected throughout urban to suburban towns and various congregations. And that's how we arrive at the issues. So that when we say this is what we're working on, those issues are backed up by story after story of our members who have experienced the real effects of those particular issues on their lives. And then we form research teams made up of people from various congregations to look at within that particular issue, how do we identify something that's winnable, something that we can actually change, and then use the power of all of our congregations to arrive at that change. So I'll just give one example of one issue, and then you'll hear about the other issues in this video. But most recently, the very first bill passed this legislative session in Connecticut was to repeal welfare liens. In the state of Connecticut, anytime you enter or receive state assistance, the state keeps track of that. And if you ever come into money at any point in your life, you are expected or forced to pay that back. And they recover those funds by putting a lien on your house, should you own a home, or intervening in any recoveries you get from auto accidents or health insurance disputes. Whatever form of cash it is that you come into, the state claws that back if you've been on state assistance. And so our 38 member congregations in GHIAA identified that issue, wrote a bill to repeal it, led a public education campaign, and worked hard with our legislators to educate them about that issue. And we repealed that law within the first 3 weeks of this legislative session. And that's just an example of one of the issues that we work on, and how sort of the power that we bring because we have so many institutions working together on a set of common issues allows us to be successful. The other thing I will add is that we are not a single issue organization, nor are we an organization that will always stick with the same issues. So the issues come and go based on the experience and stories of our folks, and also based on what we have the power at any given time to win. The issues are also not always legislative. Our education campaign right now is working with 10 school districts to make sure that all the faculty and staff in those districts, through commitments through the superintendent, receive anti-racism training. And we have a major slumlord campaign that has been in the news quite a bit in the last few years, ridding Hartford of some of the worst slumlords, and then passing laws to make sure that the ability of slumlords to come in and purchase properties in the city have been taken away. And so it's a nice mix of both legislative, but also non-legislative and on the ground issues. So what I'd like to do now is ask Rabbi Fliegel to go ahead and play. It's a 4-minute synopsis of the opening founding of GHIAA when we launched in 2019. That just gives you a sense of the scale, the scope, and what the issues are.
institutions and throughout our communities that an injury to one of us is an injury to us all.
We did not want to create another discussion group or host forums that never lead to action. We wanted the collective power to change the structures of injustice.
Hartford schools are underfunded, and urban schools are not prepared culturally for my black son to learn in an environment conducive for learning because of his skin color.
From hearing racial slurs carelessly thrown in the hallways, to learning that 2 students had felt the need to post photos of themselves in blackface on social media, I realized my community was far from perfect.
Superintendents from throughout Greater Hartford, where we have GHIAA congregations, have been asked to make a commitment on creating anti-racist cultures within their school districts, starting at the top. At this time, we ask them to state their commitment publicly.
My name is Kim Nguyen. I'm the Assistant Superintendent in Farmington. My name is Kathy Greeter, and I'm the Superintendent in Farmington, and we say, yes!
Healthcare is a God-given human right. It is not a commodity.
I can only imagine that I am not alone here tonight. Many present know someone, a family member, a friend, a neighbor who has been touched by gun violence. Actually, I wonder if you would stand tonight if you're one of those people that has been touched by gun violence. Wow. Thank you.
I won't truly be free until the tens and thousands of people crippled by the criminal records be given a real second chance. So I was granted my pardon.
Connecticut is one of only 2 states in the entire country, New York is the other, which forces recipients receiving public assistance like welfare to pay it back, even if it means losing their home. So we are excited to announce that GHIAA has created a repeal bill that will be introduced in the next legislative session to put an end to this practice.
Please state your name once more and respond by saying yes or no.
State Senator Derek Slapp, yes.
State Representative Jillian Gilchrist, yes.
Representative Joshua Hall, absolutely yes.
You could go into a bedroom where little babies were sleeping and see walls and roof covered with mold. It wasn't just the federal government. It wasn't just that we had slumlords. We as a city failed too, and the residents stood up and they pushed for change. We rewrote the housing code in the city of Hartford that hadn't been touched in decades. Our city council voted unanimously to adopt those changes about an hour ago.
Great, thanks. So I hope that gives you a sense of the kind of spirit and energy, but also the specificity of the issues that we take on. And one of the things you noticed, I think, was the legislators were present at that. When we do actions, we have folks who are with us, who have the ability to make commitments publicly and stand by those commitments. And so that is one of the reasons why I think we're able to be effective on these issues because we engage with folks one-on-one, get their public commitments, hold them accountable for that, and work with so many congregations that we have the constituent base to really be able to be engaged in a way that gets recognition and attention to move this work forward. So there are so many different things that could be shared, so many campaign stories to tell. But I think one of the best ways, again, of highlighting it is to dig into this one issue that we're working on now, racism as a public health crisis, that came about following the murder of George Floyd, when Black and brown leaders in GHIAA came to GHIAA's leadership and asked that we take on issues of police accountability and racism as a public health crisis. And the clergy caucus and our delegates assemblies agreed to do that. An issue team was formed, and we're now working with others in the state to have racism declared as a public health crisis in the state of Connecticut, which would be followed up by a series of legislative actions and proposals, the formation of a commission to see this through in the state of Connecticut. And there's a bill right now that I believe Rabbi Fliegel will talk about later. But to take us more deeply into that issue is one of our amazing GHIAA leaders, Dr. Tom Buckley. So I'm pleased to be able to introduce him right now. Tom Buckley is an emeritus research professor at UConn School of Pharmacy after previously coordinating the public health and health policy course. He continues to be a clinical researcher, a research consultant with the Khmer Health Advocacy Group, which is a Cambodian American community organization that serves the survivors of the Khmer Rouge genocide. I've known Tom for a while now, and I'm so deeply inspired by his work, his passion, his commitment. And he has just been a tremendous leader of GHIAA's healthcare team, and also just a great partner, and brings huge spirit to GHIAA. He is a member at Westminster Presbyterian Church, and I believe he performed a solo routine with a Bob Dylan song to try to get Westminster to have the most folks at GHIAA's turnout as possible. So he is a man of many skills and talents, and it's my pleasure to introduce Tom Buckley.
Thank you, Cori. Yeah, the Bob Dylan song and me shouting at the founding in October of 2019 are probably not two of my greatest moments, but it was certainly the inspiration of GHIAA that spurred me on. Just an hour ago, I was with Cori's colleague, Pat Spear, talking with a couple of congregations, and Pat was really the one who talked about power and relational power, and again reminded us the difference between politics with a small p and politics with a big P. And I think that's always good to get us back into thinking about how we work within our communities. It's a thrill for me to be invited to this group. Thank you so much for inviting me here. And this is it's such a commitment and dedication to you all to be able to take on this topic and dig deeper into it. And Rabbi Cantor really gave you the inspiration for getting out in the community and talking about this. I think my role was really to give you a little bit of background information about it. It's wonderful for me to see people and names on this screen that I'm very familiar with in a variety of communities. In my Yukon community, I see Susan Levine and Sarah Willen. In a previous community life, I worked with Robin Landau to resettle a Syrian family a few years ago. I see Tracy Tabak there, who's on our healthcare team within GHIAA. So there's just a number of communities that are working together on this process. So my background is really both a combination of pharmacy and public health, but I've spent a number of years working in Southeast Asia. I worked in the middle of Burma's civil war in refugee camps, and I've worked in Cambodia a number of times. And I think when I find myself in the middle, especially in Burma, or what we know as Myanmar now, we always question and kind of ask, where is the justice? And when we come back to Hartford, I ask that same question, where is the justice? So I want to share my screen now and give you a little bit of background about how maybe we can think about this in various ways. What I'd like to do is start off by thinking about how racism as a public health crisis is really related to health equity. And I think it might be important for us to step back a moment and think about how we talk about equity. and realize that people come in different sizes, physically and culturally. And when you treat them all equal, you give them one box. And only the tall person gets to reach that apple of opportunity. When you give them some support, then hopefully other people can reach that apple of opportunity. And so when they're treated equitably, they all get to that apple of opportunity, in theory. However, we know that, and I think this depiction is a little better for me, because we know that whatever support you give some people, barriers still exist. And so when we look from left to right on this screen, we see that when we remove the barrier, we can more fully get to hopefully equity, and that equality does not equal equity in our communities. And what are these barriers that we're working with? It's the essence of why we think racism is a public health crisis. Those things at the bottom of the screen: poverty, discrimination, access to good jobs, education, housing, safe environments. These are all components of racism as a public health crisis, and what we refer to as the social determinants of health. So what does it look like when we remove barriers? Well, Cori had talked about this previously. One of the barriers we removed was welfare liens. We're working on criminal justice reform through the Clean Slate Initiative, removing that barrier of people being incarcerated for years and having that against their record. Working on structural racism, removing that barrier. Working on removing slumlords from the north end of Hartford. So when we think about structural racism, or sometimes referred to as systemic racism, I like the definition from Dr. Kamara Jones, who says that a system of power that structures opportunity, education, housing, jobs, justice, these social determinants, and assigns value, whether it's worthy or unworthy, or full of potential or full of menace, is based on race. And so when we talk about structural racial inequality, we talk about multiple institutions that affect that. And what I really like in this description that she gives is that on the left-hand side here, the intent to discriminate is really irrelevant. Structures just do what they do. And that reinforces this disinvestment and disparities. These social determinants here on the right-hand side of the screen, these social determinants, these are universal. They're not assigned by accident. When we think of racism as a public health crisis, this means that structural racism drives these social determinants unequally. This is not a new concept we're talking about in terms of racism as a public health crisis. And I give you just a slight history lesson here. Almost 20 years ago, in 2002, the Institute of Medicine came out with this report called Unequal Treatment. This was commissioned by Congress, where the charge to the Institute of Medicine was, look at all of the literature, the data that has come out in the last 50 years. And more recently, they looked at data in the last 10 years to look at the differences in health outcomes that are not attributed to access issues. Because we're all familiar that people are going to have different access. And that at that point, of course, this is before the Affordable Care Act. So there was even wider disparities between access to health insurance. But what were the roles of bias, discrimination, stereotyping at both the individual level and at the systems level of healthcare? And what this report showed, and it was very controversial when it got released, it was on the front page of the New York Times, talked about throughout healthcare and outside of healthcare, was that racism in mortgage lending, housing, employment, criminal justice, they're all connected to racial health disparities. And this was one of the first times that it was brought out into the open and talked about very clearly. And some people really took offense to this. I know healthcare providers took offense to this. No one wants to be called being stereotyped, or that I'm in the middle of biasing when I work with my patients. But yet we know that there are differences, that even when we equilibrate access to healthcare, these differences exist. So this slide's a little bit difficult to understand, but this is directly from the Unequal Treatment report. And I simply want to point out here that the disparities between the quality of healthcare from non-minorities to minorities, that difference is rooted in the systemic disparities in healthcare. And by systemic disparities, we could be thinking about cultural and linguistic barriers, the incredible fragmentation of our healthcare system, the inability of people to receive care in the same way and from the same types of practitioners that everyone does in our community. Some people receive care in a community health center. Some people go to private physician offices. We have a complete fragmentation of care where people are not communicating with each other within care. And then this discussion of discrimination becomes very, very much a hot button topic, where the system itself creates such a time constraint that clinical uncertainty many times comes into the equation, especially when we're working with people from a different culture of our own. And thank you, Rabbi, for mentioning, and mean this to go out for public consumption, but mentioning cultural humility. This is what I'm getting at when I talk about cultural humility, that we have such small amounts of time that we work with people, that I might have seen a Laotian person a week ago. The next Laotian person I see, what do I bring into that clinical encounter with me? These time pressures sometimes lead to what we refer to as cognitive shortcuts or priors, where we might be subtly influencing or biasing our decision-making based on people from a community that's not our own. And so that report took many, many previous reports and tried to put it into some rational conclusions. And this is just one of many studies it looked at. This study's a bit dated now. As you can see, it's from 1999, but there were hundreds, literally hundreds of studies that were similar to this. This study took 8 actors, and you can see these 8 actors are 4 women, 4 men, 4 Black, 4 white. All of them went to the emergency room with the exact same symptoms of what looked like heart disease, but not all of them were given the same treatment. And in fact, time after time when this study was replicated, 6 out of those 8 actors were referred to cardiac catheterization at over 90% of the time. Now that means they were, one way to look at it would be they were fully worked up for what might be a heart attack. 2 out of those 8 actors were referred to cardiac catheterization less than 40% of the time. And I was not going to say who these 2 were. I was going to let you guess, but it were the 2 Black women. So that study, again, mimicked with many other studies across every other condition, showed that there were some differences in how we treat directly on an individual level and on a systems level. And yet here we are, nearly 20 years later, after unequal treatment, that we know racial disparities persist, not just in Connecticut, but of course nationally. Connecticut, while we sometimes puff out our chests because we're one of the healthiest states in the country, and yes, we're ranked 4th or 5th healthiest in the US, but we're somewhere between 43 and 47 on health disparities, meaning that we are in the top 10 of the worst health equity states in the country. And I'll just leave you with these 3 conditions that point to why we're at that status. In asthma, Black Connecticut residents are nearly 5 times more likely than whites to go to the ER because of asthma. And Hispanics are 4 times higher to go to the ER or the ED because of asthma. The disparity in diabetes is stark between Black and white residents in Connecticut. More than twice as many Blacks die from diabetes, and 4 times are more likely to be hospitalized for diabetes. Hispanics are twice as likely as whites to be hospitalized for diabetes. And infant mortality, the numbers in Connecticut mimic the horrific numbers across the country, where babies born to Black women in Connecticut are nearly 3 times as likely to die as babies born to white women. And in Hispanic mothers, babies are twice as likely to die. And I bring this point up because this next slide takes it even more starkly. That a Black woman, the differences between Black women and white women in heart disease, 70% more likely to perish from cervical cancer, 243% more likely to die from pregnancy or childbirth related causes, Black women and white women. So again, these numbers keep repeating themselves 20 years after unequal treatment. One other piece of history I'll share with you is this term called weathering. And this is a term that Arlene Geronimus actually started working with when she was in Princeton in the 1970s. And she published it in 1992, although the concepts were talked about a little bit earlier. And it's a general concept that describes how social disadvantage corrodes health. In public health, one of the things she looked at was, especially in her work in Princeton and now in her work at the University of Michigan, she looks at the health of the mother and the health of the baby as proxies for sometimes community health. In fact, many times we use the rate of infant mortality as a proxy to look at the overall health of a community. Well, we know that the infant mortality rate overall is high for teenagers. But then generally, in the general population, especially in the white population, the infant mortality rate goes down in your 20s and then starts to rise again in your 30s. So if you can see, I'm making a U-shaped curve where the rate is high as a teenager, goes down in your 20s, and goes back up again as you approach 40. That's not the case in African-American women. And in fact, African-American women have a lower infant mortality rate if they gave birth as a teenager than if they gave birth as a person in their mid-20s. Because that effect of corrosion of cells, this weathering effect, makes them actually the age of their cells appear older than they are. So the African-American rate is double the rate of white women of infant mortality in their mid-20s. So essentially, instead of a U-shaped curve in African-American women, it's almost a straight line between, and in fact, it goes up from teenage years and as they get older. So what's happening here? There's actually a biologic connection now that again got published, again, another history lesson here back to 2006, where they connected this term of weathering, which was considered more of a social science term. And in fact, Arlene Geronimus was kind of scorned for many years. People sloughed off that term of weathering. They didn't appreciate much power that it had until now. And then they started linking it to cellular level and started coming up with a term called allostatic load. And this, again, I won't go through this too much, but it's basically showing that environmental stressors, major life events, and trauma and abuse are sometimes what we might refer to as microaggressions, lead to more pressure and stress on our tissues at our cellular level. So this term allostatic load causes our cells to divide faster as a result of this continuous trauma through the community, through your environmental stressors, which causes an early deterioration of organs and tissues, or what we refer to as premature aging. One thing that I liked, I heard Arlene Geronimus speak a couple of years ago, and she used the analogy of the game Jenga. If you're familiar with the Jenga game, where people put in pieces of wood, interlocking wood to create a tower. And then you play by pulling out little pieces of wood until the tower collapses. And she thinks about weathering and allostatic load, that we pull out those little pieces of wood and eventually the entire tower collapses. And that's what weathering is, that eventually we have all of these stressors that build up and put these pressure on our tissues until it collapses. So what have we seen through the COVID-19 pandemic? We've seen that Jenga tower collapse on itself. In essence, we've pulled back the curtain on health disparities and this lack of health equity. And I think this is what makes it so appropriate now to have a campaign on racism as a public health crisis. Because what have we learned? Apparently not much, because what we've seen in COVID-19 is that these disparities continue, in fact, at even greater rates. Compared to whites, Latinos, American Indian, and Alaska Natives were hospitalized at almost 4 times the rate. Black Americans hospitalized at 3.5 times the rate. Blacks are dying at twice the rate of COVID as whites. And you can see these disparities now, if anything, just have widened. So one of the things that we did with this legislation, this House Bill 6662 that Cori talked about, one of our colleagues, Sarah Willen, thank you, Sarah, for bringing on one of your colleagues, the two main authors of this document produced by the Justice Collaborative Initiative at St. Louis University, Professors Yearby and Lewis, actually came to testify for us on that bill. They provided oral and written testimony, and they're the authors of this document called Racism as a Public Health Crisis. Here's how to respond. And one of the quotes I pulled out of that is this, that the COVID-19 pandemic and recent police violence have laid bare a system of racism that drives inequality in all aspects of American life, including education, employment, healthcare, housing, and law enforcement. In essence, it's really brought to light what we've already known for many years, but has not been brought out to the public quite as much. What this group does, what Professor Yearby does in leading this group as collaborative, is that they actually review all of the policies and laws from every state around the country. And I think they're up to over 200 cities have declared racism as a public health crisis. I think it's up to 8 states now. And they do a continuous review of the policies. And what they found is that there's some best practices that these laws or policies should do, because we know that just declaring public health racism as a public health crisis, yes, is an important first step, but what else should we be doing? And so what I advocated in my testimony to our legislators is that we should be including at least one, if not all of these 5 best practices to define racism as a system that impacts all the key areas of the social determinants of health, to provide material, institutional, and social supports to redress the historical and current practices of racism, to require the use of a racial equity tool. So when we review any kind of policy or legislation, we put it through the prism of this racial equity tool to see what the impact is across races and cultures, to give racial and ethnic minorities the power to participate in the decision-making process, the real power to participate, not cursory power. And then finally, which I think would be tremendous, but that so few states, if any, will do, is to incorporate a healing process such as a truth and reconciliation process to address the trauma of experiencing racism. And what Professor Yearby mentioned in her testimony was that some states have incorporated one of these. Not a single state has incorporated all of these. And Connecticut's bill does not incorporate any one of these. So I urge them to try to incorporate at least one of these. And I would urge us through our advocacy to move forward, not necessarily driving these best practices home, but use this as a basis to keep pushing our legislators and our policymakers in that direction to truly make this an impactful legislation, if it will be a legislation and policy moving forward. So I'm going to stop there and stop sharing my screen. And thank you again for inviting me today.
Thank you, Tom, and thank you, Cori. And in the interest of time and respecting everybody's time, we're going to skip the question and answer period, and we're going to our conclusion, which is a call to action, which Rabbi Andi Fliegel will present. Rabbi Fliegel joined Congregation Beth Israel in July of 2016. She was ordained in 2016 by the Hebrew Union College Jewish Institute of Religion, where she earned master's degrees in both Hebrew literature and religious education. Since joining CBI, she implemented an ongoing mental health initiative and formed gender-based teen groups, empowering teens to reject sexism and develop healthy peer relationships. She also started an annual retreat for 9th grade students to explore sex and sexuality from a Jewish perspective. She serves on the clergy leadership team of GHIAA and the Board of Connecticut branch of Religious Coalition for Reproductive Choice. And I'll turn it over to Rabbi Fliegel.
Thank you, Steve. Thanks, everybody. So inspired by this teaching from Pirkei Avot, just like Rabbi Cantor, I want to invite us all to take a deep breath and remember these words that opened and now will close our time together. You are not obligated to complete the work. No one of us as an individual, no single community, not even the collective power of GHIAA is going to solve the centuries-old crisis of racism as a public health crisis. We know that, we acknowledge that, our own limited human capacity in our single lifetimes, but neither are we free to desist from this work. It is our job to move the needle. It is our job to be a part of generational change. So one of the bills, the bill that both Cori and Tom mentioned is House Bill 6662. This declares racism as a public health crisis and in Connecticut, and is a starting point for steps forward. It is not, this doesn't do it, right? This doesn't tie things up with a bow, but it is a step forward, and it is one that GHIAA is heartily supporting. So one thing that you can do right now is, we don't know exactly when this is going to go to a vote, but you can contact your legislators through calls, through written testimony to them, to let them know about your support for House Bill 662. And specifically, this is a bill that's inclusive of a number of different items, and we need to make sure that declaring racism as a public health crisis stays within it. So you can reach out to them and tell them how important it is to you as their constituent that this part of the bill remains intact. If you live outside of Greater Hartford, or if you're connected to people who live outside of Greater Hartford, something that is also really helpful to us at this stage is setting up meetings with legislators outside of our Greater Hartford region. So if you have those connections, reach out, let one of us know, and if you can help to set up a meeting with those legislators, with yourself or whoever their constituent is, and with a member of the GHIAA staff, to have a conversation about the importance of racism as a public health crisis within this bill, that would be incredibly helpful as well. And then next, this Wednesday, this is a chance to pray with your legs, to show up in person if that's something that you're able and ready to do. This Wednesday at 9 a.m., there's a press conference and rally organized by our partners, Connect and the ACLU, for Clean Slate. So Clean Slate is one element of this structural racism that Tom opened his conversation, the framework for us, one part of that big wheel. People who have served their time, who do not deserve to have a life sentence that follows them around, their record that keeps them from getting adequate housing, with being called back for interviews, really just diminishing the ability to get a job, to live life. Clean Slate wipes the slate clean for people who have served their time and deserve a chance to really re-enter society and provide for themselves and live a crime-free life that is only really truly possible without a record following them around. So that's coming up this Wednesday. You can try scanning the QR code right there on the screen, or I believe Lydia's going to put it in the chat. The link to register for all of you will be asked everyone to be socially distanced and to wear a mask while you're there. We'll close with these words. May we feel both a sense of urgency that responds to this moment, and work to cultivate the slow burning endurance that is necessary to combat racism in all of its forms in our society. May we recognize the humanity of our partners, the divine spark within us all that mandates us to show up to this work. May we lean into the discomfort that comes with confronting the inequities, the disparities that abound within our own communities and that painfully exist within our own selves. May that discomfort, that anger, that sadness agitate us, inspire us to self-reflection and action. May we embrace each other, embrace the power of collective voice, embrace the call that we are created in the image of God, that divinity within us is screaming from the depths of our souls to confront racism as a public health crisis. Amen.
I think that concludes our program for today. Thank you, Rabbi Fliegel. Thank you to all of our presenters, and thank you to everybody for joining us. We hope you will follow the suggestions that Rabbi Fliegel made and our call to action, and have a great day. Thank you.